With your evacuation ready bags completed, inside you should have a first aid kit. That first aid kit should include the following: a hot bag, cold bag, micropore adhesive, a cotton applicator, band-aids, gauze, a tongue depressor, a thermometer, bandages, scissors, cotton balls, alcohol, betadine, face masks, triangular bandages, and a medicine dropper. First aid kits can be homemade or be bought readily prepared online. Now let's learn how to apply first aid onto burns. First degree burns. First, you must immediately cool the burn under cold running water until the pain subsides. This will reduce pain, swelling, and future scarring. Next, cover the burn with a sterile non-adhesive bandage or a clean cloth. Make sure not to apply ointments or butter to the burn, as those can cause infections. Over-the-counter medication can be used to help relieve pain and reduce inflammation. Second degree burns. First, you must immediately cool the burn under cold running water or a cool compress for 10 to 15 minutes. Then, dry the burn with a clean cloth and cover it with sterile gauze. It's important to remember not to break the blisters. Make sure not to apply ointments or butter to the burn, as those can cause infections. Elevate burned arms or legs. To prevent shock, lay the victim flat and elevate the feet 12 inches. Then cover the victim in a blanket. Third degree burns. Firstly, cover the burn lightly with a clean cloth or sterile gauze. Make sure not to apply ointments or butter to the burn, as those can cause infections. Treating trauma with first aid. The first step is to control the bleeding. Use a dressing and your gloved hand to apply firm and direct pressure to the injured area. Continue until the bleeding stops. If there are multiple wounds, treat the worst injuries first, then move on to the lesser bleeding injuries. Then, wait for medical professionals to show up. If one is impaled by an object, it is best to leave the impaled object alone, as removing it can cause damage to blood vessels. For head injuries, try to stabilize the head and neck manually.